Imagine a doctor that never sleeps, never gets tired, and can analyze millions of data points in a single second to diagnose your illness. A doctor that can read an X-ray faster and more accurately than any human radiologist. That's the promise of AI in healthcare. It's a technology that's revolutionizing medicine, pushing the boundaries of what's possible. But with great power comes great responsibility, and this revolution is not without its costs. The very same technology that can save lives can also create profound ethical dilemmas. What happens to our most private health data? What if the eye is biased against certain people? Who is to blame when an eye makes a mistake? In this video, we're going to dive into this incredible and complex world. We'll explore the groundbreaking ways AI is transforming medicine, from early disease detection to personalized treatments. And then, we'll get real about the serious ethical challenges we must address to ensure a future where this technology benefits everyone. Stick around, because the future of medicine is here, and it's more complicated than you think. First, let's talk about the incredible leaps forward. The breakthroughs are happening right now, and they're reshaping how we think about health. The human eye is amazing, but it can't compare to an eye that's trained on millions of medical images. For example, AI algorithms are becoming incredibly skilled at identifying subtle patterns in X-rays, CT scans, and MRIs. Studies have shown AI models can spot bone fractures or detect early signs of diseases like diabetic retinopathy and even cancer with a level of accuracy that meets or exceeds human experts. This isn't about replacing doctors, it's about giving them a superhuman tool. An AI can serve as a second opinion, flagging potential issues for a radiologist to review, which can speed up the diagnostic process and prevent misdiagnoses. Beyond imaging, AI is a master of predictive analytics. By analyzing a person's genetic data, lifestyle, and medical history, AI can predict the risk of developing conditions like Alzheimer's or heart disease years in advance. This gives doctors and patients a critical window to take proactive measures to prevent or delay the onset of an illness. For too long, medicine has been a one-size-fits-all approach. But AI is changing that by making personalized medicine a reality. Think about genomics. AI algorithms can analyze a person's unique genetic makeup and health data to recommend the most effective therapies. In cancer treatment, for instance, an AI can analyze a tumor's genetic profile to identify specific mutations, then suggest a targeted therapy that is most likely to work for that specific patient. This moves us away from the old method of trial and error, saving precious time and improving outcomes. AI is also supercharging drug discovery. It used to take years, sometimes decades, to find a single drug candidate. AI can now sift through massive databases of chemical compounds and predict their effectiveness and potential side effects in a fraction of the time. This accelerates the process of bringing new, life-saving drugs to market. And it's not just about the clinical side. AI is freeing up doctors and nurses to do what they do best: care for people. Administrative tasks like scheduling appointments, managing billing, and creating clinical notes are time-consuming and prone to human error. AI-powered tools can automate these processes, reducing burnout and allowing healthcare professionals to focus on the human connection that is so vital to healing. The breakthroughs are breathtaking, but they come with a shadow. The same power that enables these advances raises some of the most complex ethical questions of our time. AI in healthcare is data-hungry. It needs massive amounts of sensitive patient data to learn and improve. But this creates a huge risk. Who owns this data? How is it stored? And is it truly protected from misuse or breaches? Regulations like HIPAA in the United States and GDPR in Europe are designed to protect patient privacy, but they weren't created for an era of pervasive AI. Ensuring patient data is properly anonymized and secured is one of the biggest challenges we face. Bias and fairness. This might be the most critical issue. AI is only as good as the data it's trained on. If a dataset used to train a diagnostic AI is predominantly composed of data from a single demographic, the AI may fail to accurately diagnose or treat patients from different ethnic or socioeconomic backgrounds. For example, a study found that a widely used algorithm for managing high-risk patients had a racial bias. Because less money is historically spent on black patients with similar conditions, the algorithm systematically underestimated their care needs and favored healthier white patients. This kind of algorithmic bias can perpetuate and even worsen existing healthcare disparities. It is a very real problem. Accountability and liability. When an AI system is used to diagnose a patient, and that diagnosis is wrong, who is responsible? Is it the developer who created the algorithm? Is it the hospital that implemented it? Or is it the doctor who followed the AI's recommendation? The black box nature of many AI models, where the decision-making process is opaque and not easily understood, makes it incredibly difficult to pinpoint liability. This could lead to a legal minefield and undermine trust in both doctors and the technology itself. Informed consent. Finally, there's the question of informed consent. Do patients truly understand the extent to which an AI is involved in their care? If an AI is assisting with a diagnosis or recommending a treatment plan, should the patient be fully informed of this? The complexity of AI makes it difficult to explain, yet the principle of patient autonomy demands that individuals have the right to make informed decisions about their own health. The future of medicine isn't about AI replacing humans. It's about a human-AI partnership. AI can handle the repetitive, data-intensive tasks, freeing up doctors to do what they can't, provide empathy, compassion, and nuanced clinical judgment. The goal is for AI to be a powerful tool that augments human expertise, making healthcare safer, more efficient, and more accessible to everyone. But for this future to be a reality, we must face these ethical dilemmas head-on. We need to demand transparency from developers, advocate for diverse datasets, and establish clear regulations for accountability. So, what do you think is the biggest ethical challenge of AI in healthcare? Let me know in the comments below. And if you found this video insightful, please hit that like button and subscribe for more content on the fascinating intersection of technology and society.